You are watching IndiaNewsTamil.com.
And gentlemen, I take immense pleasure in welcoming you all on behalf of Vinita Hospital for the press meet. I am Shafina Bashir, Head Marketing Communications, Vinita Hospital, a unit of Vijay Ganga Specialty Care. After the COVID-19 pandemic, a digital health has become highly demanded. However, the quality of health and patient safety become questionable. To find solution, we have gathered here for the announcement of the 3 healthcare partnership first time in India. Now I call upon Mr. Vinod K. Dasri, a chairman, to take over the dais. Dr. Sarita Vinod, Managing Director, Vinita Hospital. Mr. Sanjeev Malhotra, CEO of VDOC. And Mr. Sujit Chakrabarti, CEO of Smit Fit.
Welcome to Vinita Hospital. Let me just briefly talk about the Vinita Hospital, where our vision has been to provide world-class healthcare and to make it affordable as well as accessible. And we always want to make sure that we are providing global standards and yet delivering it with Indian values. One of the things as we go around and read more and more magazines, we find out that nowadays 1 in 5 people in India are struggling with diabetes and hypertension. The problem is, in the state of Tamil Nadu, it's actually 1 in 4 people are struggling with diabetes or hypertension. Equally, what is bad, more than this, is that the stage from pre-diabetes to diabetes, the growth at which that is happening, in India it is happening 3 times faster than the global average. It's much worse that the rate of diabetes in India has become much younger than before. As such, we set out our mission to make sure that we let people celebrate and enjoy their quality of life if they take right decisions at the right time. When we set up this Vinita Hospital as part of the Vinita Health group, we had a 3-pronged approach. First and foremost, to build a truly world-class hospital which has a world-class team, a world-class facility, as well as world-class equipment. Equally, while it sounds quite odd, we wanted to make sure that only those people who are required to come to the hospital do actually come. There's lots of other people who can be taken care of closer to their home, and especially with the COVID times, nobody wants to come and visit a hospital. So we wanted to set up a whole bunch of neighborhood clinics inside corporations, clinic inside apartment complexes, and even in rural areas through our Health at Home. And finally, we wanted to make sure that those people who wanted to enhance their lifestyle were able to take control of their life, would be able to do so by connecting to us digitally. While we were embarking upon this journey, we decided to partner with some of the best in this fields in this country. First and foremost, I'm proud to announce a partnership with VDOC Clinics. It's virtual doctor clinics. And I'll ask my friend Sanjeev Malhotra in a minute, CEO of VDOC Clinics, to talk about it. And after Sanjeev, I'd like to introduce Mr. Sujit Chakrabarti, who's the CEO of Smit Fit, a brand new app that they have launched, which can not only help you improve your lifestyle choices, as well as provide you continuous glucose monitoring in a very innovative way. We are proud about these partnerships because of the cutting edge technology and the innovations that they bring forth. This partnerships that we are launching today will significantly enhance the pace at which we can offer world-class care and make it affordable and accessible. To reduce the costs at Vinita Hospital, we are also partnering with Niramaya Clinics, Niramaya Path Labs, who have done hundreds of thousands of these the lab tests, and they bring that expertise directly to us. So without further ado, I'd now like to invite Sanjeev to talk briefly about VDOC and what they do.
Thank you for giving us this opportunity for this partnership. With respect to VDOC, basically we are primarily focusing on improving the primary healthcare delivery network all across India. Because we will be taking the healthcare closer to your home and closer to where the patient needs it. How we do it, for that I would like to, whereas doctors, without compromising on the quality of care, would be able to examine the patient, and we, being on the patient side, would be able to assist the patient, be a bridge between the patient and the doctor, and provide them the same quality of care in cases if the doctor is not available at the wee hours or faraway places, and simultaneously have a multi-speciality options available. So that's what is the value proposition with respect to this. How and why we are here partnering with Vinita Hospital and such partnerships is basically it comes from our philosophy of access, consistency and coordination of care. So now that is very important. So first, the healthcare should be accessible to all. Second, there has to be consistency across that whatever information we gathered at the primary healthcare when you are well, not that sick, or when you're well, that data flows on when you have some serious concerns, and hospital has the access to that data. And then if your serious illnesses are there, hospital can take care of it. But when you are out of the hospital back to your home, over there a continuous care is happening. So that is a coordinated care. So this is a three-circle approach. In this, without further ado, I would like to call upon our friend Sujit, who will talk about the self-care and basically how to make you more healthier. Sujit, if you could. Thank you.
Good afternoon, everyone, and welcome to this session. First of all, we are extremely excited about this partnership because it furthers our own vision about taking healthcare to the masses and making it accessible, affordable, and some of the other attributes that Vinod talked about. To give you a bit of background about Smit Fit, and we'll shortly show you a video as well, we are a comprehensive digital healthcare solution with a clear focus on preventing, managing, and also reversing conditions like diabetes. Vinod gave you some of the facts, and I'm sure these are facts that will sink in, right? If you look at Tamil Nadu and Chennai, 1 in 4 adults are living with these chronic conditions. And what is also important is the need for prevention, right? The rate at which things are progressing. So at-risk people are becoming, known diabetics at a rate which is much faster, right? So our population of people living with diabetes will only increase with time. So hence, we stand for prevention and management of these conditions. Just another fact which Vinod touched about a few. I don't know how many of you know that diabetes, the source of diabetes starts 11 to 13 years before diagnosis, before your blood glucose starts rising. So just imagine the impact that we can have if we can start to focus on prevention. So with that background, we at Smit Fit have a very simple philosophy. Sanjeev talked about it, which is the notion of self-care. By the way, I myself have almost reversed my own diabetes following the same approach, and I would strongly attest to the need for self-care. What is self-care, right? You go to a hospital or a clinic when you see there is a need and there is something which you want to get checked. But what you do within and between doctor visits or clinic visits around your lifestyle and control is what we define as self-care. So we call it the Pentagon of lifestyle interventions. What are these? Nutrition, sleep and relaxation and stress management, exercise and yoga, self-awareness, how aware are you about your own health and the different parameters, And finally, medication adherence, right? Because we know that's key for people who are living with these conditions. So what we try and do is combine all of this into a very personalized plan for every individual, set goals for them, and we will show you some of the details in the video shortly. The second aspect, which is very key, Vinod mentioned it, is the use of technology around health monitoring. There are a lot of advances happening in this space. I'm sure you will know many people living with diabetes who have to keep pricking themselves and drawing blood to test. Well, now there are technologies where you don't need to do that, right? So I'm wearing what is called a continuous glucose monitor on my arm. It's a small coin-shaped sensor, and look, on the app it's giving me what my sugar levels are, right? This is the power of technology, and this is what we are trying to bring to prevention and management of diabetes or any other chronic conditions. And finally, we also deploy lifestyle coaches, whether they are nutritionists, exercise coaches, yoga coaches, psychologists, to help people manage their condition. So if you think about all the three parts, whether it's a hospital, whether it's a virtual clinic, or what we do, together we can make a big difference. So,
welcome to the press meet again. We are proud to announce 3 partnerships today which help us move along the path to achieve our vision at Vinita, which is to be a world-class healthcare provider which is very affordable as well as accessible. And to do that, we are launching 3 partnerships. The first one is with Niramaya Path Labs to help us reduce the cost of our labs. They are a leading path lab agency based in New Delhi. We are also launching a partnership with VDOC Clinics for several clinics in and around Chennai, which are virtual in nature and are the pioneers in evidence-based telemedicine. And to have a continuous digital connect with our patients, we are launching a partnership with Smit Fit. Sujit is here from Smit Fit. It's an app-based lifestyle solution, digital solution, which can be used for not only monitoring your own health as well as consulting nutrition coaches, health coaches, and if necessary, the hospital. So, translate everything to Tamil.
ಎಲ್ಲರಿಗೂ ವಣಕ್ಕಂ. ವಿನಿತಾ ಹಾಸ್ಪಿಟಲ್ ನಮ್ಮ ಏಮೇ ಒಂದು ಮೊದಲಿಂದ ಪ್ರಿವೆನ್ಷನ್ ಇಸ್ ಬೆಟರ್ ದ್ಯಾನ್ ದ ಟ್ರೀಟ್ಮೆಂಟ್ ಅಂತ. ಸೊ ಪ್ರಿವೆನ್ಷನ್ பண்ணுறதுக்காಗಿ ನಾವು முதலிந்தானே கிட்னி ப்ராப்ளம்ஸ் ப்ரிவெண்ட் பண்ணணும் ಅಂದರೆ ಅದಕ್ಕೆ ರೀಸನ್ಸ್ ಡಯಾಬಿಟೀಸ್ ಹೈಪರ್ ಟೆನ್ಷನ್ ಇದೆಲ್ಲமே ப்ரிவெண்ட் பண்ணணும். அதே மாதிரி லைஃப் ஸ்டைல் மாடிஃபிகேஷன்ஸ். இந்த ப்ரிவென்ஷன் ನಾವು ரொம்ப ஆக்சசபிள் ஆகி மீனிங் எல்லாರಿಗೂ ரீச் ஆகிற இடத்துல இருக்கணும், எல்லாருக்கும் எஃபர்ட் பண்ணுற மாதிரியும் இருக்கணும். அண்ட் ஒரு சிம்பிளாகி ஒரு லைஃப் ஸ்டைல் ரெகுலர் லைஃப் ஸ்டைலில் கொஞ்சம் மாடிஃபை வித்தின் ஒரு ஹெல்தி லைஃப் ஸ்டைல் எப்படி கொண்டு வரணும். அது ஒரு நாள் ஒரு டாக்டர்னை விசிட் பண்ணி வீட்டுக்கு போய்ட்டு வந்து முடியாது. ஸோ தே நீட் டு பி கண்டினியூஸ்லி ஹேண்ட் ஹெல்ட். ஸோ அது எப்படி பண்ண முடியும்? ஸோ ಅದಕ್ಕಾಗಿ ವಿ ಹ್ಯಾವ್ ಕಮ್ ಅಪ್ ವಿತ್ ಇನ್ನಿಕ್ಕೆ 3 ಆರ್ಗನೈಸೇಷನ್ಸ್ ಜೊತೆಗೆ ವಿ ಆರ್ ಜಾಯ್ನಿಂಗ್ ಹ್ಯಾಂಡ್ಸ್. ಅದು ಇದಕ್ಕೆ ಒನ್ ಇಸ್ ಅ ಲೈಫ್ ಸ್ಟೈಲ್ ಮಾಡಿಫಿಕೇಷನ್ಗೆ மீனிங் ஒரு எக்ஸசைஸ் பண்ணுற எப்படி பண்ணணும் எவ்ரி டே, மீனிங் ஒரு நாள் போய் டாக்டர் பார்த்துட்டு வீட்டுக்கு போயிட்டாருன்னு இந்த நடுவே எப்படி அவர் எக்ஸசைஸ் பண்ணணும், எப்படி ஸ்லீப் பேட்டர்ன் எப்படி ஹெல்தி ஆகி மாற்றணும், அவர் டயட் எப்படி பண்ணுற கொஞ்சம் நல்லா ஆகும், அவரை பற்றி அவருக்கு தெரிஞ்சுக்கிறதுக்காக என்ன பண்ணணும், அதுதான் இந்த ஸ்மித் ஃபிட் ஆப் ஒன்றும் வரும். அதே மாதிரி இப்போ அவருக்கு கொஞ்சம் சின்ன சின்ன ப்ராப்ளம்ஸ் இருக்குது. சின்ன ப்ராப்ளம் அது டாக்டர்கிட்ட வரணுமா, ஹாஸ்பிட்டலுக்கு வந்து டைம் வேஸ்ட் ஆகும், இல்லை ரொம்ப தூரத்துலேருந்து இருக்கார் அவರಿಂದ வரதுக்கும் ஆகாது கலர் டைம். ஸோ அந்த பேஷண்ட்ஸ்க்கு எல்லாமே ஒரு ஜஸ்ட் ஃபோன் கால் பண்ணினோம், இல்லை ஒரு வீடியோ கால் இல்லாமல் வீடியோ கால் வித் அன் எவிடன்ஸ் பேஸ். மீனிங் என்ன ஆகும், நான் இப்போ பேஷண்ட் என்கிட்ட வந்துட்டார் ಅಂದರೆ ಅವ್ರ ಜೊತೆಗೆ பேசுறது மட்டுமே இல்லை எக்ஸாமினும் பண்ணுவேன். இப்போ வீடியோ காலில் அது முடியாது, பட் இந்த விடாக்ல என்ன ஆகும், நம்ம எக்ஸாமினேஷனும் பண்ண முடியும். ஸோ அதனால் நான் ஒரு டெசிஷನ್ಗೆ ಈಸಿಯಾಗಿ ಬರೋದಕ್ಕೆ ವಾಯ್ಪು இருக்கும். ಅದಕ್ಕಾಗಿ இந்த ವಿಡಾಕ್ ಜೊತೆಗೆ ವಿ ಹ್ಯಾವ್ ಮೇಡ್ ಅರೇಂಜ್ಮೆಂಟ್ಸ್. ಥರ್ಡ್ ಒಂದು ಮೀನ್ ಇನ್ ಕೇಸ್ ಅವ್ರಿಗೆ ಹಾಸ್ಪಿಟಲ್ಗೆ வந்துதான் ஆகும், தென் டெஃபினெட்லி நம்ம ஸ்பெஷலிஸ்ட் மீனிங் கிட்னி ஸ்பெஷலிஸ்ட்டோ இல்லை டயபிட்டாலஜிஸ்ட் எல்லாமே எல்லா கடை இருக்க முடியாது. ஸோ வித் லெஸ் நம்பர் ஆஃப் பீப்புள் வி கேன் மேனேஜ் மோர் பேஷண்ட்ஸ், ரீச் கொஞ்சம் அதிகமாகும், அவருக்கும் கொஞ்சம் வசதியாக இருக்கும். ಅದಕ್ಕಾಗಿ ವಿ ಆರ್ ಟ್ರೈಂಗ್ ಟು ಡೂ ದಿಸ್. ಥರ್ಡ್ ಒಂದು நிறைய டைம் டாக்டர் கிட்ட வரும்போது மோர் தென் த டாக்டர்ஸ் கன்சல்டேஷன் இட் இஸ் ஆல்சோ த பிளட் டெஸ்ட் காஸ்ட் ஆகும். அந்த காஸ்ட் கம்மி பண்ணுறதுக்கே வி ஆர் ட்ரைங் டு ஒர்க் வித் நிராமியா லேப்ஸ். ஒரு ரொம்ப நிறைய இடத்துல பண்ணுறதுனால காஸ்ட் கொஞ்சம் கம்மி பண்ணுறதுக்காகவும் ஸோ ஓவரால் ஒரு பேஷண்ட்டுக்கே இந்த எக்ஸ்பீரியன்ஸ் ஒரு லைஃப் டைம் ஜர்னியாக இருக்கணும். ஹெல்த்துக்காகி அவரை பற்றி அவருக்கே தெரிஞ்சுட்டு அவர் இருக்கிற இடத்துலனே ஒரு நல்லா அவர் லைஃப் ஸ்டைல் மாடிஃபை பண்ணுறதுக்கு ஒரு வாய்ப்பு இருக்கும். காஸ்ட் கம்மியாகும் அண்ட் தே கேன் லீட் அ நார்மல் லைஃப். அதுக்காக
like, share and subscribe to indianewstamil.com.